Hi, guys, and welcome. Hi, Dr. Steve. How are you today?
Doing just fine, thank you.
Fantastic. Thank you so much for joining us. It's really good to have you here on the platform. So as we get started today, this is our first Facebook Live of 2025, and it is also our kick-off birthday Facebook Live. So February is Online Pet Health's birthday. This month we are turning 8 years old. It's incredible to think that we're kind of approaching the 10-year mark now, and I think that's really exciting. So thank you to our community that makes that possible, really. But what it means when it's our birthday is that we get to spoil our community rotten. And we've partnered this year with Vol to do exactly that. So we have 2 free webinars available to you guys throughout this month. It's very easy to register for them. I'm going to pop the link up on the screen. There we go. So if you head over to onlinepethealth.com/gift, you can register for Dr. Steve Adair and Dr. Rachel Kane's webinars, and you can watch those for free throughout the month. Now, if you've already watched Dr. Steve's webinar, I hope you have some questions, and today is your opportunity to ask those questions. To everyone who joins the conversation today, you'll have an extra entry into our competition. So this month, we are running a lucky draw competition together with Val, where you can win one of 3 prizes. The first is an online pet health membership. The second is the textbook, Essential Facts of Equine Physical Therapy, Rehabilitation, and Sports Medicine for the Equine Community winner, and Essential Facts of Physical Medicine, Rehabilitation, and Sports Medicine in Companion Animals for the Small Animal winner. So if you guys are joining us live, please join the conversation. Comment, ask questions. Every comment is going to get an extra entry into the competition. Every registration for the webinars gets an entry into the competition. Okay, fantastic. I think that is everything that I needed to share with you before we got started. So today we're going to be chatting about regenerative rehabilitation of equine tendon injuries with Dr. Steve. Will you please introduce yourself, Dr. Steve, and your interest in regenerative medicine for supporting tendon healing? I'm going to get nicely tongue-tied on the regenerative medicine today.
Sure. I am a professor of equine surgery and sports medicine and rehabilitation at the University of Tennessee College of Veterinary Medicine in Knoxville, Tennessee. Have actually been a veterinarian for 42 years. Actually double boarded, board certified in surgery and sports medicine and rehabilitation. Been working, for a long time, doing surgery, that was my thing. Chance to cut's a chance to cure type of situation. But after many years, I got to thinking there's got to be more to it than just surgery. And there's more to rehab than stall rest. I mean, because if we sat there and looked at it, we used to say, well, it's 30 days in a stall, 30 days in a paddock, 30 days kicked out to pasture. Then we'll see what we've got and go from there. Nowadays, you can get started immediately on things. And so I think we get much better outcomes with proper rehabilitation. So that led me to really develop an interest 2005. And so I've been doing this for 20 years now. And so we opened up a equine rehab center here at the university back in 2013. The rehab course we teach, we actually started it in 2005. So it's been going on roughly 20 years. That's pretty much it. I do clinical medicine. I'm on the clinic floor. I do research, and then I teach. And so that's pretty much what I do on a day-to-day basis.
Thank you so much for that introduction. There are two things you said that I absolutely love. You mentioned that ethos of a chance to cut is a chance to cure, and how you grew out of that. And I really love that, because I think there's that belief is still so strongly held by many surgeons, and there's more that we need to be considering than just a chance to cut is a chance to cure. So I love that. And then you brought up the rest versus early mobilization, especially when it comes to tendon healing, and how we've changed our approach a little bit in recent years, which I'm very excited about, because really early mobilization has so many benefits and can, I hope, improve our outcomes for tendon healing significantly. So to those that have joined us in the last few minutes, guys, welcome. It is so good to have you. Dr. Steve Adair has presented a webinar on regenerative rehabilitation of equine tendon injuries, and that is available for free to the entire community. So Dr. Steve, will you please tell us a little bit about that webinar and what people can expect to learn if they attend it? And while you talk about that, I'm going to pop the link up on the screen so that anyone who wants to register, who hasn't registered yet, you can still do that up until the end of this month. It will be available for free. Okay.
So this, what this is about is, this is actually kind of a not necessarily a hot topic, but a current topic in human medicine and human physical therapy. And that's the combination of our regenerative medicine and rehabilitation. So it's kind of melding the two together. And so what we find is, in the webinar that I present, I go through the different types of regenerative medicine, orthobiologics, etc., that can be utilized in tendons and ligaments, and then go through the rehabilitation techniques that can be utilized to improve our healing. And so it's basically combining those two. And then I finish it up with a couple of cases just to demonstrate the outcomes that you can get when you do combine your regenerative medicine, orthobiologics to and rehabilitation. So that's what they're going to get. Especially what I think is beneficial is for those that are not familiar with all the different regenerative medicines that are out there. This is an opportunity to at least get a little bit of familiarity with them. I mean, it's not an in-depth, bookworm type of situation. It's a broad overview, so what's out there, such as stem cells, platelet-rich plasma, uh, uh, those type of biologicals that are out there, and where we use them at. So.
Okay, perfect. I love that. Thank you so much. So if you guys haven't registered for that webinar, go ahead and do that. onlinepedhealth.com gift. Anyone can register. If you're in our community, if you're not in our community, it doesn't matter. This is available for free. So go right ahead. And then a benefit to registering for this webinar is that you'll be entered into a lucky draw at the end of the month, where you can win one of 2 of Vol's textbooks, as well as an online pet health membership. So only benefits, no disadvantages. Okay.
I'm going to put in a plug for the equine book, because I'm one of the editors on it. I mean, it's huge. Hang on. Just so y'all can see it. I mean, it is huge. And so it's like 300 and something. Well, actually, I'm sorry, it's 800 pages. So it's pretty much everything you wanted to know about equine rehabilitation. So y'all need to enter to get a free copy of it, for sure.
I agree. That one's on my list. So I have this one, and it is a
Yeah.
fantastic,
Yeah.
fantastic resource. Honestly, I refer to it very often, and it's so huge. It's amazing. And
Yeah.
I've gone through the
Dr.
Equine one. I've
Yeah.
managed to just get my hands on a copy to scan through it, but I don't have my own yet. So that one's on the
Yeah.
top of my to get list.
Yeah. Dr. Millis is my cohort. He's over in small animal. I'm on equine. And Dr. Levine actually is a human PT, teaches down at University of Tennessee, Chattanooga. So we're all kind of under the same University of Tennessee umbrella.
Yeah, these textbooks are fantastic. Highly recommended. So good job. So to everyone who's live with us, join the conversation. If you've watched the webinar already, this is your chance to ask questions. Every question, every comment is going into the lucky draw, as well as every registration to the webinar. So you can get lots of entries in if you engage and chat with us on social media. And if you haven't registered, hopefully this conversation whets your appetite for that.
Sure.
Okay. So let's talk about tendons. They have a well-known poor recovery rate, a poor prognosis. So what currently is our prognosis? If we look at the research, what is the expected outcome for tendon recovery?
Depending on, and I think it depends on how the management is and the severity and which tendon is actually involved. So, I mean, there's going to be a lot of variation. I mean, bottom line is it can be anywhere from, if you've got just a mild tendonitis, that would carry a very good to excellent prognosis for return to function. Whereas if you've got a significant disruption of the tendon or ligament proper, that can be a pretty poor to career ending. So it's hard to narrow it down into, you know, one specific prognosis simply because of the variability that occurs in the clinical cases. So, you know, it just previously, prior to us becoming more aggressive in our therapies, um, you know, the prognosis was always guarded. You know, you take a thoroughbred racehorse, it's got a significant bow tendons, superficial digital flexor tendonitis. You know, they were kept in a stall under bandage for 2 to 3 months, and still had a high instance of recurrence once exercise was returned. Now, my opinion, that's no longer the case. I think with the advancement of equine medicine and rehabilitation techniques, I think the prognosis certainly is much better.
It's much better. Yeah. So I always like to lean back on the research that we have. And as far as I know, we really only have research that is looking at that period of extended stall rest and then this graded return to function, which really doesn't incorporate a proper loading program. And as you say, that's really poor or guarded with a high recurrence of injury once they return to work. Do we have any studies that have looked at that prognosis with the incorporation of regenerative medicine? Do we know that yet? Do we have any data on that? Or is it still too new for us to really have evidence behind it?
It's really still too new. There hadn't been enough well-designed studies, and that's the issue that you get into with all of this, is the quality of the studies that are done. And so you've really got to look at the scientific literature with a critical eye. And basically, just don't read the abstracts and the conclusion. You actually need to get down into the body of the paper and look and see how the study was designed? Was there control? And that's what we're seeing. A lot of the stuff that is coming out are prospective clinical trials, but they don't have any controls. And
Mm,
so you don't know, is the intervention, whatever the intervention is it actually doing what we're thinking it's doing? Everything is compared back to historical, and so it's a little bit difficult. So, in answer to your question, yes, there are actual studies out there with experimental models of tendonitis, of desmitis, etc., and regenerative medicine that show improvement, but they're not clinical cases.
mm,
And so it's not it's a very short term, low numbers of individuals, and they do histopath or MRI, and they show, yes, there is improved healing, but does that translate into uh, return to sport,
mm,
type of situation? That's what we're lacking. We know the regenerative medicines do help with healing, but what does that affect long term? And
mm.
that's where the we're lacking in the information.
Yeah. Perfect. I love that. I love research so much, and I am not, blind to the drawbacks of it. It's not always something that you can bring back to clinical practice, but I love reading it anyway, and seeing how the studies are conducted and thinking about what it could mean for us. So thank you for sharing that. I really like that. So can you go a little bit deeper into how the regenerative therapies actually promote tendon healing? What is happening? How does it work?
So for the most part, and everybody thinks about stem cells, and you inject stem cells, and they turn into tenocytes, etc. And that's really not the case. What what these biological agents are doing is they provide a source of growth factors that
Mm,
improve the healing environment. They also provide what we call chemoattractants. So they put out signals that signal the body that there has been an injury, and it aids in recruitment of cells coming into the area to heal.
mm,
Uh, Within our bloodstream, there's stem cells circulating all the time.
mm,
And so what you're basically doing is putting compounds or putting components into that lesion, and they are saying, "Hey, come on down here. We've got some problems. We need help to heal."
mm,
And so you get the body's natural cells coming in to promote it. So they're acting more, these orthobiologics, the regenerative medicine cells, are acting more as signal.
mm,
And so they're signaling that, and then they're also improving the environment.
mm,
You've got to have a good environment. They act to stimulate vessel ingrowth, because you need the blood to be coming into the area to provide cells not only for healing but also to clean up all the debris and stuff like that. So
mm,
it's very important. You need oxygen coming into the area, so you don't have this hypoxic, uh, poor environment for healing. And so that's basically what our regenerative medicine is doing. And
mm,
that's your platelet-rich plasma, because your platelets have alpha granules in them, and the alpha granules or they degranulate and provide growth factors. Exogenous stem cells, either allogenic or autologous stem cells, they are acting to recruit the body's own stem cells in. Then you got autologous conditioned serum. You got autologous protein solutions. So you've also got IRAP, interleukin receptor antagonist protein. So all of these basically aid in promotion of healing.
Mm. How do we select one orthobiologic above another? How does that?
Some of it depends on availability. Okay. And it depends on what a person has in practice. I mean, I pretty much here at university, we have everything. But my main tool is stem cells. I'm really a big fan of stem cells. I do think platelet-rich plasma does a good job, at least in my hands. If I'm using platelet-rich plasma, I have to do 3 injections at 10 to 14-day intervals. So that's 3 trips into the hospital. That's 3, sticking needles into the lesion. Whereas with stem cells, I can usually get by with just 1 injection. And so I think a lot of it depends on what you have available, and certainly the timing of the injury. A lot of times we don't want to be injecting, $2,000 worth of stem cells into a core lesion on the tendon when it's in the process of what we call the debridement phase, where it's actually being cleaned up. And so then the body's own natural defenses basically eat up the stem cells that you're injecting in there. So a lot of it has to deal with timing and what you have available in practice and what your regulations are in wherever you're practicing at. I mean, there's some European countries that you can't use stem cells. So yeah, so it just depends on where you're located at and what the availability is.
I did not know that some European countries don't allow stem cells. Why is that?
It's just a regulatory situation dealing with the utilization of biologicals and specifically stem cells. In the U.S., we're pretty lucky. Really, the only thing, in animals, we can actually use any type of stem cells, be it an embryonic stem cell or what we call a mesenchymal stem cell. But most everything we do here is mesenchymal stem cells. We don't do a lot of embryonic stem cells. And so, but it's just a regulatory mechanism, kind of passes down from humans. It's just, to be honest with you, you can't do human stem cells here in the U.S., but you can go to Europe and do human stem cells in Europe, in some places. So it's
interesting.
It all has to deal with government regulations.
Okay, very interesting. I believe most of those are available in South Africa. I don't know of any restrictions in terms of stem cells, PRP. I think all the products are usable here, but that's really interesting. I could read up a bit more about that. Okay, so that regenerative therapies was the one part, but then most of us vet rehabbers are not actually using that. We're rehabilitating horses that are being treated with an orthobiologic. So I want to chat a little bit about how we know which of our modalities we should and shouldn't be using and at which phase. So I know laser therapy could potentially interact. Shockwave therapy is another one. So how do we incorporate our rehabilitation modalities into a horse's rehabilitation program that is being treated with regenerative therapies?
So I use the KISS principle, which is keep it simple, stupid. And we do not like throwing a kitchen sink at any rehab case. And so, to be honest with you, It really, for these tendons and ligaments, it doesn't require a lot
Mm,
uh, as far as expensive modalities. Um, and if you go through, human physical therapy, I'll be honest with you, they very rarely use modalities.
mm,
It's most of the time it's exercise
mm,
and mobility. I mean, the three things that we look at, and I take this over from the human aspect as far as my stages, uh, is one, I like to control pain.
mhm,
Second is mobility, and the third is strengthening. So those are going to be the three tiers of the foundation of the rehab plan.
mm,
And so, the first thing we start out with is pain control. So, what are we going to do to control pain? And then I'll just say that, all right, an acute bow tendon. What are we going to do? So, how are we going to control the pain? Um, in my hands, there's going to be two primary methods, not drug related, because we've got to be a little bit careful. Uh, Everybody likes to throw non-steroidal anti-inflammatory drugs in there, but they can retard healing.
yeah.
So we do have to use some, but we try to use them judiciously. So, what are going to be my two primary methods to decrease pain and inflammation in an acute tendon? It's going to be cold and it's going to be laser. Those are the two. And I mean, uh, those are going to be the two things that we use. I like laser for its anti-inflammatory properties and its
Mm,
analgesic properties. I also utilize laser around the time I'm doing stem cell injections because it's been shown that the laser has a stem cell stimulatory effect. Okay. The one other modality that I do use, but it's not in the acute phase, though it could be, is radio frequency. We
mm.
do a good bit of radio frequency therapy here too. So,
Oh,
but
cool.
primarily because it also has been shown to have a stem cell stimulatory effect, and additionally, depending on your settings, it can also have a mild anti-inflammatory action. But for the most part, what I'm going to do in the acute phase is going to be ice, or it's going to be
Laser.
laser. Those are going to be.
Cool. So I really love that. So if I kind of summarize what I'm getting from this is an acute tendon that's painful, we're going to be icing and lasering. And then they're going to go from that inflammatory phase into the debridement phase. And then you haven't mentioned what you're going to do in that phase. And then once they start to come out of that, we want to incorporate regenerative therapies, right?
It's a little bit quicker than that. So the
Okay.
acute phase, I'm going to consider acute phase. Uh, Initial acute phase is going to be the first 72 hours.
Yeah.
Okay. Uh, then I'm still going to be using. I probably would have been using cold mostly and laser in the first 72 hours. Then I'm going to go more to laser. Then at that 10 to 14 day interval, that's when I'm going to be coming in with my regenerative therapies. Okay. Now, I do think it's important to recognize is I'm also starting at about that 3 day mark exercise.
Mm,
And I am a huge proponent of controlled exercise. And
mm,
one thing that I think you've got to look at is what is that horse doing in the stall? Well, if it's sitting there
mm,
walking around the stall on its own, then what is the issue with taking it out and just walking it down to the end of the barn aisle and walking it back? Okay.
mm.
That's not a problem, provided the horse isn't an idiot and is going to go all over the place, pull away, run down the aisle, etc. The other thing I'm a big proponent of is, and this is specifically dealing with injuries to the flexor apparatus, deep digital flexor, superficial flexor, inferior check ligament, suspensory ligament, distal sesamoidian ligaments, is articulated braces. And that allows me to dial in how much load I'm placing on the flexor apparatus. So I'm a huge fan of controlled exercise, starting early, within the first week of injury, to do the controlled exercise. So that's pretty much what we're doing for the first 2 weeks. And then after that, I will probably stop the laser and probably go with radio frequency therapy during that time. Continue with a gradual increase in my exercise with an articulated brace. And then probably about, at least here, probably about the 30-day mark, I'm actually putting them into the underwater treadmill. And so again, I'm increasing exercise, and I may even change to a different surface. I may go from a firm surface to a little bit softer surface. And actually, in reality, during this whole period of time, actually from day one, we're doing baited stretches, neck stretches, butt tucks, sternal lifts, trying to interact with those individuals as much as possible. We reevaluate lameness and ultrasonographic at 30-day intervals. We actually do full evaluation weekly, and we change it on a weekly basis. If I'm 45 days in and the horse is out working over some poles at hand, and all of a sudden I notice that tendon is becoming a little bit hot, maybe a little more painful, I'll back off on the level of exercise and maybe start back on laser for 3 or 4 or 5 days. So everything is very dynamic with us. We don't do packages. We don't say, oh well, we're going to sell you 10 laser treatments. What we do, we have rehab levels, level 1, level 2, level 3. And level 1 includes up to 3 daily interventions or modalities. Level 2 has 4, and level 3 has up to 5 or more interventions and or modalities. So, the modalities would be radio frequency, therapeutic ultrasound, laser, radio frequency, pulse electromagnetic, working over poles, underwater treadmill. Those are all the different tools that we have, but they're selected based on the case. And we just don't say, okay, we're going to do everything we got on this horse every single day. We don't do that.
Yeah.
It's that would be inappropriate. And we have moved more towards exercise than we have modalities. We still use modalities. And we'll use, depending on the situation, we'll use E-stem, we'll use TENS, it just depends on the individual case.
I love that. I love that exercise and graduated loading is becoming the primary consideration when we're thinking about tendon healing. And in line with that, the graduated braces makes it so much more accessible to go into that a loading or an exercise program and feel safe, because it is so easy. We know that's I think that's really where the extended stall rest comes from is that horses like to be madmen and jump into the air and buck and kick, and it's just, that's a lot of loading on a tendon that's healing, which we want to avoid.
But you know what we have found. I mean, we've had horses come in to us that are on all different kinds of drugs in order because they are not handling the stall rest, confinement well, etc. And what we have found is that the more we interact with these individuals on a daily basis, less need for drugs. Now, I'm going to be the first one to admit rehab's hard work. It's not, let's go over there and throw this laser on and then move on to the next one. Most of our patients in here, we're spending 3 to 4 hours a day with these, so they'll go through all their buttocks and lifts. They may be on balance pads. We'll throw balance pads in there later in the healing process to get asymmetrical loading. So, that those right there would take 30 minutes, and then they go in the underwater treadmill for 40 or 45 minutes. Then they may have a radio frequency therapy that's another 20 minutes. Then they have lunch. Then they go out in the arena, walk over poles and stuff for another 30 to 45 minutes. So it's a pretty labor intensive situation. And so we just, like I said, we just don't go out there and boom, throw everything at them and walk away.
Yeah. Do you prefer to rehabilitate tendons in-house, to have them boarding with you?
That's my preference, especially early. Certainly the first 30 days. Now, after that, we have exercise programs that we send home with them. We've got software that we utilize in order to prescribe a very specific, and it has instructions in it. It has videos in it. It was actually developed by a couple of human PTs, and it's really a nice software that we utilize, and we send that home with the owner, so they've got at-home exercises, and then they can either bring the individuals back to us for reevaluation, or they can take videos, they can take pictures, and send them back to us, just kind of as updates. But I mean, to a certain extent, I'm a little bit of a control freak. My preference would be is to have them so I can actually put my hands on them on a daily basis. Now, do I do all the treatments? No. I do the evaluations, I set up the plan, but I've got some very good technicians and vet assistants that carry out the treatments for us. And like I said, I just do myself and Dr. Orsini, the other doctor that works in the rehab center. We do the evaluations, and then we set the plans up. And that's the main benefit to having them in-house, is to be able to do a more frequent evaluation, because like I mentioned earlier, you may come in from doing work in the arena one afternoon, and all of a sudden the tech says, I think that tendon looks a little bigger, and I come down and look at it, and I can palpate it and I can say, yeah, maybe we overdid it a little bit today. Let's go ahead and let's back off on the arena work tomorrow, and let's put some laser in instead, so that's the nice thing about it.
Yeah, I completely agree. You can more quickly pick up if things aren't going to plan and adjust and adapt according to the horse. And having that, multiple times a day, having those touch points, that's huge. Yeah, bringing out the exercise and the loading over the day. huge. Yeah.
It is, but I mean, a lot of times that's not realistic. And so, I mean, let's face it, and I mean, we're not exorbitant, but for a horse to stay with us for at a level 1 rehab, they're going to have 4,000 a month in that, and it's not uncommon for with our caseload. We pretty much have cases in here all the time, and most of them are staying 2 and 3 months at a time. So you know, it's easy for us to follow these cases along. Now, when they leave here, they're actually ready to go into ridden exercise. So that's our goal. If we have one here, we have got this horse to a stage that the owner can be turned out into a small round pen, small paddock, and the owner can actually get on its back and start doing some ridden exercise. Now, they may still be in an articulated brace, but at least they can get on their back, start doing some tack walking, and then go to walk trot, and then they go to walk trot canter. You know, so it's more of a graduated type.
I was going to ask if they'll often start with the articulated brace in ridden work. So thank you.
Yeah, we do, and that's the ones that are out there today. They certainly can be utilized both at hand and being ridden. So they're pretty, but again, it's for the flexor apparatus. So you've got to be a little bit careful on what you're actually rehabbing as to what you use and where it's appropriate.
Yeah, I love that. So if that in-house rehabilitation isn't available, can you offer distance consultations and
Sure.
guidance? Yeah.
Sure. Yeah, that's not that's not an issue. We do it all the time. Dr. Orsini and I we consult on cases, and you know, so that's not a problem as far as distance consultations go.
Fantastic. Guys, thank you so much. Dr. Steve, thank you for your time today. It's been really amazing having you. To all of those that have joined us live, it's been great having you with us. Thank you. Thanks for the comments and the questions. Those are fantastic. I want to share one more little thing with you guys. So as I mentioned, we are partnering with Vol this month to really spoil you guys for our birthday. And one of the things that Vol has made available is a 10% discount on all of their courses, all of their certifications. So if you go to the website and at checkout, you use the code OPH10, which I've put up on the screen now, you're going to get a 10% discount on all of their courses. And then their textbook, you can get a 5% discount if you use the code OPH5. So those are really fantastic resources and offers. And I hope that you guys get to make use of that this month. If you haven't yet registered for Dr. Steve's webinar, you can do that at this link here, onlinepedhealth.com/gift. And that will be available for the whole month to anyone who would like to participate. And then we're running the competition. So every registration gets entered into the competition. All of the comments here today are going to get entered into the competition, and you'll stand a chance to win one of the Vol textbooks or an online Pet Health membership. Guys, thank you so much for joining us today. Steve, thank you.
Thank you so much.
Awesome. Bye, guys.
Bye-bye.